Dear readers, today we are pleased to share the research findings published by Professor Xiaobin Zhu's team from Xiangya Hospital of Central South University in iMeta. The study is titled Efficacy and Biomarker Analysis of Neoadjuvant Disitamab Vedotin, RC48ADC, Combined Immunotherapy in Patients with Muscle-Invasive Bladder Cancer, a multi-center real-world study. Bladder cancer is one of the top 10 most common cancers globally, with 20% to 30% being muscle-invasive bladder cancer. More than half of MIBC patients cannot benefit from neoadjuvant chemotherapy. Recent clinical trials have shown that neoadjuvant immune checkpoint inhibitors exhibit favorable efficacy in MIBC patients. In recent years, antibody-drug conjugates have demonstrated excellent clinical benefits in advanced patients, but there is a lack of research on using ADCs as neoadjuvant therapy. This is the first study to evaluate the efficacy of neoadjuvant RC48ADC combined with immunotherapy in bladder cancer and explore biomarkers based on single-cell RNA sequencing. Through rigorous and comprehensive analytical methods, we have drawn the following outcomes. Based on strict inclusion and exclusion criteria, a total of 102 patients who received neoadjuvant RC48ADC combined with immune checkpoint inhibitor therapy were ultimately included in this study. We conducted statistical analyses of the patients' baseline data. Regarding efficacy, 38 patients, 37.3%, achieved pathological complete response, and 39 patients, 38.2%, achieved pathological partial response. Follow-up data showed that the one-year disease-free survival rate was 97.4%. Multivariate logistic regression analysis revealed that clinical stage and histological type were significantly associated with treatment efficacy. We collected 11 MIBC samples and performed single-cell RNA sequencing on them. All cells were clustered into 10-cell clusters. Additionally, we divided all epithelial cells into 4 subclusters. Based on differentially expressed genes between subclusters, we conducted functional enrichment analysis and annotated the cells according to their functions. C2 significantly increased post-treatment and had the highest proportion after treatment, indicating that C2 might be resistant to the treatment. All cells in C4 were in the G2/M or S phase, suggesting a highly proliferative state. Enrichment analysis eventually expressed genes before and after treatment indicated enhanced stress responses in tumor cells post-treatment. The intersection of overexpressed genes in the 4 subclusters after treatment was HSPA1A. HSPA1A significantly increased in the post-treatment group, while HER2 decreased. Meanwhile, HER2 expression enriched in C3. We noted that in samples achieving complete response, HER2 expression in C3 was significantly higher than in other samples that did not achieve CR, while the median HSPA1A expression was 0. Scatter plots of the median values of HER2 and HSPA1A showed that C3 tumor cells in CR samples had the characteristic of HSPA1A non-expression and high HER2 expression. All bladder cancer epithelial cells had high CNV levels. C2 exhibited the highest CNV level, indicating it is primarily at the endpoint of evolution. The 4 subclusters were distributed along a single evolutionary path. Tumor stem cell markers ALDH1A1 and KRT20 were highly expressed in C3 and C4 during the early stages of evolution, indicating their tumor stem cell properties. HER2 and HSPA1A expression remained relatively stable during the evolutionary process of bladder cancer epithelial cells. The proportion patterns of HER2 and HSPA1A expression in C3 were similar to those of other subclusters, indicating that the expression characteristics of HER2 and HSPA1A originated from C3 rather than new mutations arising during evolution. In conclusion, this study is the first to evaluate the efficacy and biomarkers of neoadjuvant RC48ADC combined with immunotherapy in bladder cancer, and the preliminary findings are as follows. Neoadjuvant RC48ADC combined with immune checkpoint inhibitors demonstrates good efficacy in MIBC patients. Predicting treatment efficacy based on single-cell RNA sequencing is feasible. This study will expand neoadjuvant treatment strategies for patients unsuitable for receiving neoadjuvant chemotherapy.